Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editor's highlights and a summary of our open access publications available to everyone.
Vitiligo research is entering a transformative phase, moving from descriptive observation toward immune restoration and holistic care. Advances in understanding regulatory T-cell dysfunction have reframed vitiligo as a systemic immune imbalance that may be corrected through targeted immune modulation. New data highlight that even in children, carefully monitored systemic immunosuppression and emerging Janus kinase inhibitors can achieve safe and effective disease control. The combination of 308 nanometers excimer laser with JAK inhibition exemplifies how synergistic approaches can yield durable, localized repigmentation. Beyond clinical endpoints, attention is turning to the patient's lived experience. Early intervention, psychological support, and transparent communication are now recognized as essential components of successful care. At the same time, the rise of social media underscores both opportunity and risk as misinformation competes with evidence-based guidance. Together, these developments signal a new era in which immune repair, technological innovation, and empathy define the future of vitiligo management.
We have great news. Both commentaries included in the January issue are open access. One, written by Juan Ruano, centers on JAK family expression and therapeutic implications in primary cicatricial alopecias. Another, by Renata Bozo and Laura Kiss, explores novel perspectives in aesthetic dermatology, with a focus on epigenetic regulation.
The related review by Haikal et al. Discusses longevity in detail, including epigenetics, aging, and personalized care. The concept of aging has evolved from being primarily attributed to genetic factors to recognizing the critical role of epigenetic mechanisms. Recent advancements, such as epigenetic clocks, have provided tools to assess biological age and offer insights into aging processes at the molecular level. In aesthetic dermatology, understanding these processes allows for more personalized, effective interventions, targeting the root causes of skin aging. This review explores the interplay of epigenetic changes, aging, and the potential of personalized care to enhance longevity and skin rejuvenation. This review is based on an extensive literature search conducted across PubMed and other scientific databases. Studies focused on epigenetic mechanisms such as DNA methylation, histone modifications, and their relationship to skin aging. Particular attention was given to recent advancements in biological clocks, including Horvath's clock and Grimmage, and their implications for personalized dermatological treatments. Epigenetic clocks, such as Horvath's clock, have demonstrated utility in assessing biological age through methylation markers, revealing actionable insights into aging processes. Energy-based devices, such as fractional lasers and radiofrequency, have shown promise in reversing age-related epigenetic changes, promoting collagen synthesis and reducing biological skin age. Additionally, lifestyle factors such as diet, sleep, and circadian rhythm alignment significantly influence epigenetic aging and skin health. Integrating epigenetic insights into aesthetic dermatology represents a paradigm shift in skin rejuvenation, allowing for personalized treatments that address visible signs of aging and underlying molecular mechanisms. Using biological clocks provides a framework for tailoring interventions to individual patient needs, optimizing outcomes, and extending the longevity of aesthetic results. Future research should focus on longitudinal studies, accessibility, and ethical considerations to fully harness the potential of epigenetics in promoting skin health and overall well-being.
Moving on, a Viewpoint article by Rawlings Parker et al. Raises important considerations regarding the environmental impact of dermatological care. Healthcare generates substantial greenhouse gas emissions, and the authors suggest that incorporating life cycle assessments into dermatologic prescribing could help clinicians weigh the environmental impact of therapies, particularly for climate-sensitive diseases like atopic dermatitis. Biologics generally have far higher carbon footprints than oral drugs due to water-intensive manufacturing and cold chain packaging. Yet life cycle assessments for most medications remain unavailable and lack standardization. Integrating standardized life cycle assessments into guidelines would enable more sustainable, equitable treatment decisions that balance efficacy, safety, cost, and environmental impact.
This month, a clinicopathological challenge by Torgman et al. Presents a non-healing nasolabial ulcerated plaque. A 66-year-old male with a history of chronic epistaxis and sinusitis presented with a non-healing ulcer on the right nasolabial region persisting for 7 months. While denying additional symptoms, he admitted to recreational cocaine smoking. Examination revealed an ulcerated plaque with raised pink-edged borders extending from the right nasal rim to the upper lip. A thorough diagnostic workup was unremarkable, although wound cultures identified growth of Pseudomonas aeruginosa and Staphylococcus aureus. Despite a year-long trial of antibiotics, the ulcer remained resistant to treatment. Biopsy findings included pseudoepitheliomatous hyperplasia with a dense dermal plasmacytic infiltrate and scattered eosinophils. A 6-week course of oral steroids achieved rapid and significant clinical improvement, though the lesion recurred following steroid tapering below 5 milligrams daily.
As the editor's highlights suggested, in December, vitiligo is in our focus. A noteworthy contribution on the subject is the systematic review and meta-analysis by Lerner et al. On regulatory T-cell dysregulation. Vitiligo is an autoimmune disorder marked by the progressive loss of skin melanocytes, increasingly linked to immune dysregulation as a key driver of disease onset and progression. Regulatory T or Treg cells are essential for maintaining immune homeostasis by suppressing autoreactive immune responses. Mounting evidence implicates functional and numerical alterations in Treg cells in the pathogenesis of vitiligo. The study reviews findings on lesional and circulating Treg cells in vitiligo patients compared to healthy controls, examining Treg cell frequency, their ability to suppress CD4+ and CD8+ T cell activity, levels of the immunoregulatory cytokines, interleukin-10, and transforming growth factor, beta, expression of the key suppressive marker FOXP3, as well as levels of the pro-inflammatory cytokines interleukin-17 and interleukin-22. A total of 21 studies comprising 1,016 vitiligo patients and 846 healthy controls were included in the review. The analysis revealed a significant reduction in peripheral Treg cell counts, impaired overall suppressive capacity of CD4+ and CD8+ T cells, reduced levels of IL-10, increased levels of IL-17 and IL-22 in the blood of vitiligo patients compared to controls. No statistically significant difference was observed in circulating TGF-beta levels. Most studies reported reduced FOXP3 expression in both the skin and blood of vitiligo patients. Current evidence suggests vitiligo involves both reduced numbers and impaired function of Treg cells, supporting further study of Treg pathways as targets for immunomodulatory therapy.
Rosenberg et al. Approached vitiligo from a different angle through a cross-sectional study evaluating the quality of TikTok videos on the condition. Vitiligo, an autoimmune disorder causing skin depigmentation, significantly impacts quality of life. With over 1 billion users, TikTok has become a major platform for health information dissemination. However, its engagement-driven algorithm raises concerns about misinformation. The study evaluates the accuracy of the most liked vitiligo-related TikTok videos and examines the platform's role in health education. The authors retrieved TikTok videos using #vitiligo and analyzed the first 100 videos that met the inclusion criteria. Videos were categorized into healthcare providers and non-healthcare providers. Content characteristics and engagement metrics were extracted. 3 independent reviewers assessed quality using multiple assessment tools: the Patient Education Materials Assessment Tool, Modified Discern, the Video Information and Quality Index, or VIQI, and the Global Quality Score, or GQS. A novel tool, VTRACE, was developed to evaluate the clinical and social aspects. Of 100 videos analyzed, 25% were from healthcare providers, demonstrating significantly higher quality across all metrics. Healthcare provider videos focused on and scored higher on MDiscern, GQS, and VIQI. Non-healthcare providers produced 75% of videos, received higher engagement, and had a more positive tone. The authors concluded that vitiligo-related TikTok content lacks reliability. Healthcare providers produce higher quality content, while non-healthcare providers dominate engagement and potentially spread misinformation. There is a need for more evidence-based, engaging content to improve patient education on the platform.
Lastly, Picconi et al. Examined the impact of vitiligo on patients' quality of life through a retrospective observational study. Non-segmental vitiligo imposes a substantial psychological burden, particularly early after diagnosis, with high baseline levels of anxiety, depression, and impaired quality of life. In this study of 158 patients, 4 weeks of topical ruxolitinib led to significant improvements in all psychological and quality of life measures despite minimal clinical repigmentation. These findings highlight the value of early psychosocial support and suggest that ruxolitinib can provide meaningful emotional benefit even before visible skin changes occur.
This was the last episode of IJD in Focus in 2025. Thank you for listening and happy holidays. Until next time.